As a physical therapist working in the geriatric field, one comes across some very common injuries. These injuries may consist of damages to the nerves, muscles, and joints. One very common job that physical therapists come across is the rehabilitation after a knee replacement. According to Jonathan Cluett, knee replacements are often due to the arthritis of the knee. Arthritis is the inflammation of the joint. Over time, arthritis of the knee causes the cartilage loss and bone exposure, which causes severe pain and the need for a knee replacement. Knee replacements in older adults are very common. In many cases, this form of rehabilitation for a physical therapist can be very frustrating. This is because not all patients who have had knee surgery fully recover. This can be very frustrating for physical therapists because they are unable to fully help their patients in recovery. So why work as a geriatric physical therapist when there is a possibility that you may not be able to help your patient fully recover? What many don't realize about physical therapy is that the job of a physical therapist is to assist in performing rehabilitation through various techniques and to help teach the patient perform exercises that will strengthen the muscles in and around the injury. In the act of rehabilitation, the physical therapist has a role, but so does the patient. A patient attends physical therapy usually between 1 to 3 times a week, but it is next to impossible for them to recover in just these short time periods with the physical therapist. They give the patients exercises that they must perform daily in order to strengthen and allow flexibility among the muscles. It is essential for the patient to do these exercises in order to accomplish full recovery. Here are some examples a physical therapist may teach a patient in order to recover from a knee surgery.
Okay, Emily, so now what we're going to do, we want to focus to make sure we strengthen both sides of the thigh musculature. So the hamstrings, the big muscles back here, we want to strengthen. We're going to use this green tubing as a little resistance, and that's all I'm going to have you do. I'm going to wrap it like so. We're going to start with your knee extended, and I want you to pull your heel down like you're trying to hit the back of the chair there. Good. And relax. Make sure your movements are nice and slow. Don't make them real quick and jerky. Pull back. You feel some resistance back there when you're doing that? Excellent. And pull back. Good. And relax. Okay, so the last thing we're going to do, Emily, just because you don't have enough bend in your knee yet, just because of the trauma that happens after the surgery. So what I'm going to have you do is to sit onto this wheeled stool. We're going to start with you kind of out a little like this. And that's all I want you to do is to try and inch your way so you get a little more bend in your knee. Hold it till you feel a little bit of a stretch there. It's all within your tolerance. You're the one in control here. And then relax it back again. Okay? So give that a try. Start with your legs a little further out.
Oh.
There you go, good. And now start scooting up using this one. So you're trying to get more bend in there. You feel a stretch. Hold it there, hold it, and then relax and push back out.
Many struggle understanding the process it takes for a successful recovery of a knee replacement. What do you find in a patient that makes recovery successful and what is not successful?
I would say that, and it's not just a patient who is recovering from a knee replacement, but the first thing is the motivation factor. Somebody has to be motivated to get better. If they're not motivated to get better, then it's an uphill climb for both the therapist and the particular patient, so they have to be motivated. I would say they would need to have a good support system. There's a lot of research out there that talks about people who have a good support system at home, whether it's a spouse at home or just family in the area that can get the patient to their therapy sessions or can carry over some things in their therapy sessions is of great benefit. So I would say the folks that don't have the support and are poorly motivated are going to have more of a negative outcome.
Many times the problem in optimal recovery is the patient and their role in performing the exercises outside of sessions. It is the job of a physical therapist to motivate the patient to do the exercises and explain that both people have a role in order to obtain the goal of full recovery for the patient. It is true that sometimes something may have gone wrong during the surgery and a physical therapist recognizes that a full recovery of the patient is not possible. This can be very frustrating for a physical therapist, but one has to realize the role of a physical therapist is to aid the patient in personal optimal recovery. They may not be able to have full range of motion, but as a physical therapist, you can get them into their own personal greatest range of motion. By doing this, you are also easing the patient of a lot of pain they may have encountered before. Regardless, as a physical therapist, you are still helping the patient recover, whether it is the recovery that you wish they could reach or the recovery that they can physically reach. So back to the question, why work as a geriatric physical therapist when there is a possibility that you may not be able to help your patient fully recover? For one, you can avoid this situation by motivating the patient to do exercises outside of therapy. By doing this, it is possible to obtain full recovery of the patient. But sometimes, due to things outside of your power, it is not possible to reach full recovery. One has to keep in mind that though a patient may not have full range in motion, by giving them some range in motion and easing their pain from the surgery, you as a physical therapist are still helping them. You could be helping them so that they could help walk their dog without pain. You could be helping them from going to bed without achiness in their knee at night. Regardless, you as a physical therapist are still helping the patient. Whether you think it or not, you are still making a difference in their lives.